Good afternoon, everyone. Thank you for attending our webinar. This webinar is focused on recent Medicare card changes and their impact on your system. In this video session, we will guide you why Center for Medicare and Medicaid Services introduced these changes and why they need to issue new insurance cards. What is Medicare Beneficiary Identifier, MBI, and how all these changes are going to affect our workflow? Before we get into the details, let me first begin by telling you that you have joined this session on the GoToWebinar service. You can see a GoToWebinar panel on right-hand side of your screen. This service allows you to ask questions using the GoToWebinar panel. If you need to minimize the panel or get it out of the way, use the minimize option on the right-hand side of the panel. This will minimize the panel and will allow you to see the screen as much as possible. If you want to ask a question at any time, there is a question section on the GoToWebinar service. Open the question section, enter your question, and submit it. We will have a question and answer section at the end of the webinar. If we are not able to get to your question during this webinar, we will respond to you by email. I would like to start off by telling you a little bit about our company. MTBC was founded in 1999, and we currently serve 70+ unique medical specialties across the U.S. We have approximately 2,000 employees working in 12 offices worldwide. We are listed on NASDAQ under the symbols MTBC and MTBCP, and MU3 certified, and we are SureScript certified solutions provider. Why Medicare has issued new cards. Now would like to tell you why Center for Medicare and Medicaid Services has issued new Medicare cards. Currently, Medicare uses the Social Security number, its SSN, printed on the insurance card to identify the insurance holders. You can review this old Medicare card image for the reference. Due to the rising issues of misuse of health insurance claim number, HICN, which leads to identified theft and illegal use of Medicare benefits, CMS decided to replace the SSN with a new 11 characters long unique Medicare Beneficiary Identifier code. Format of MBI. The MBI contains letters and numbers. Here's an example. 1EG4. TE5MK73. You can review the new Medicare card specimen for better understanding. Who will get this new MBI? Now the question arises, who will get this new MBI? The answer is very simple. Everyone. Each person with Medicare will get their own randomly generated MBI. Spouses or dependents who may have similar HICNs will each get their own different MBI. How MBI can be used. Now, if someone has their MBI, how they can use it? They will use the MBI the same way they use the HICN today. During the transition period, on all transactions you can use either the HICN or the MBI in the same field, where you have always put the HICN. You don't need to say whether you are using HICN or MBI because Medicare systems are able to tell which you have used. You cannot submit both numbers on the same transaction. Once the transition period ends, you must use the MBI in the same field where you previously submitted the HICN. Transition period. CMS has started mailing the new card to people with Medicare from April 2018 and will meet the statutory deadlines for replacing all Medicare cards by April 2019. The transition period has started from April 1, 2018 and run through December 31, 2019. MTBC Products. MTBC and all of its products are fully updated with the upcoming industry changes. Now we will show you how our products are upgraded to meet these needs. WebEHR changes. In WebEHR, add the patient demographics and claim level, whether you have MBI or old HICN code. You can use anyone to put in the policy number field, and our system will process it seamlessly. Along with the policy number field, now there is a new field named HICN. That can be used if you want to keep the old HICN code for reference. Here's an image of a patient demographics insurance section. Same changes have been made in insurance section of claim form. Practice management system site changes. In the same way, we have upgraded our practice management system. At patient demo as well as claim level, you can use the policy number field to put the MBI or HICN code, and our system is capable to process any one smoothly. Parallel to the policy number, now you have a new field named HICN that can be used to store patient's HICN number for reference. Here is an image of insurance section of patient's demographics. Let's review the changes being made in claim form. Well, now we have complete knowledge of new MBI changes. And you know how you can use our upgraded products to meet these requirements? Let's open the floor to the questions. Once again, thank you for watching this webinar, and if you have any questions, feel free to contact us at 732-873-5133 extension 102 or send us an email at technicalcalls@mtbc.com. Thank you for your time. Have a good day ahead.